the CD19 CAR T-cells is very effective in treating large B-cell lymphoma, and it provide a cure to a significant portion of patients. However, unfortunately, about 50%, close to 50% of our patients do experience relapse. It's usually that happen within the first year after the CAR T infusion. Approaches and strategies to improve the outcomes of CAR T cells is an unmet need, and the one that we presented in this study is exploring the impact of low dose radiation shaped by a low dose TBI at 1 gray on the behavior and the outcomes of CD19 CAR T cells in the mouse model. And in this syngeneic mouse model, which the mice were immunocompetent, the mice were giving a lymphoma, mouse lymphoma, and then treated with mouse-generated CAR T cells as well. And then that's the control group, and then the intervention group received additional low-dose total body radiation just prior to the CAR T infusion, to study the impact of the radiation addition. And the outcomes of this experiment was startling in a sense of the mice who received the combination of low-dose TBI and CAR T cells demonstrated a better disease control and went into remission and then lived longer. While the mice that received only CAR T cells succumbed to the disease and died pretty quickly after. And to further understand the impact of this, we performed additional experimentations that include first examining or testing the CAR T level in the blood of the mice who received radiation and CAR T cells, and we established that the mice that received radiation and CAR T cells demonstrated 2 to 3-fold higher of the CAR T presence in peripheral blood compared to mice that did not receive radiation. And the other thing was testing the cytokines profile of these mice and seeing if there is any specific signal. And what we saw in this experiment is a significant increase in interferon gamma and CCL2, both as cytokines and chemokines that is known for their inflammatory characteristics and also for intratumoral trafficking and intratumor migration of the CAR T cells. Additionally, on this experiment, particularly, we examined the intratumoral trafficking or the migration of the CAR T cells to inside the tumor tissue following radiation. And that's an additional experiment with the same syngeneic model. And we found that the mice that received radiation, a combination of radiation and CAR T cells, CD19 CAR T cells, demonstrated a better intratumoral trafficking and migration of the CAR T cells inside the tumor tissue. One additional experiment is looking at the CAR T persistence, and that was demonstrated by a B-cell aplasia, since the CD19 CAR T do not differentiate between lymphoma cells and indigenous B cells. So B-cell aplasia is a good surrogate marker to follow in these mice, and the long surviving mice demonstrated B-cell aplasia all along, suggestive of CAR T presence. And after sacrificing these animals, the CAR T cells were still present in the liver and the spleen, demonstrated by flow cytometry and additional testing suggested that the CAR T, the combination of radiation CAR T, contributed to a longevity of the CAR T cells. And lastly, the group of these mice were also we were interested in understanding the impact on the T cell subset, and if there's any preferential expansion of a certain subset that could explain the benefit of adding radiation. And in this group of mice, the spleen were harvested after radiation and CAR T cells, compared to mice that received only CAR T cells. And then the T cell was collected, and we performed a single cell RNA sequencing in these cohorts. And what we found is that the T cells was more enriched in the group that received radiation. And additionally, there was a preferential expansion of a specific T cell subset called effector cytotoxic T cell subset, which is now known over the last couple of years that this particular CD4 subset is associated with superior anti-tumor characteristics. And additionally, we found that among the CAR positive, through the single cell sequencing, among the CAR positive T cells, there was a decrease in the CAR positive regulatory T cells compared in the group that received radiation compared to the mice that received only CAR T cells. So there are potential many mechanisms that could explain the improvement in the outcomes of the CAR T cells when radiation is used in this platform. I think this preclinical study suggests that this approach can be used prospectively in human in a phase 1/2 trials, and open the door to a new strategy to hopefully improve the outcomes of CAR T cells in lymphoma for our lymphoma patients, and reduce the chances of relapse by the first year.